Here to tell us what you need to know whether deciding your health insurance plans for 2020 is Craig Gussin with Arbach and Gussin Insurance and Financial Services. Good morning, Craig. It's deja vu all over again. Same topic, but now we are much closer to the deadline, which is
December 15th, Sunday.
So, folks, when it comes to health insurance, are people like they are with their Christmas shopping? Do they take it right down to the wire? Is there a peril to take it right down to the wire?
I've been debating the last couple of days, am I going to come into the office Sunday or not? Because what we found with Medicare was everybody was working the last day, which is December 7th. We're expecting most health insurance agents will probably be working this weekend because people wait to the last minute. They procrastinate. They call up Sunday, do I still have time? What do I got to do? Have you filled out your application? No, because you have to have the application into the insurance company or Cover California by Sunday.
So before you can even get involved, that application has to be, can you assist people in filling out that application, or does that have to already be done before they can bring you in?
We help them, we'll get them the application, we'll help them fill it out, but they got to sign it, they got to give us the right information we need and make sure that the doctors they want to use or the hospitals they want to use, because the networks are getting smaller and smaller to lower the cost. So if you like a Scripps doctor, you want to make sure your plan takes Scripps or Sharp. And now Sharp had a decrease in rates, so a lot of people are looking at Sharp, looking at Kaiser. HealthNet has a Scripps plan that has pretty low rates. So a lot of it, what we're seeing is, how can I keep my costs down? How can I keep using my same doctor? And then we start talking about what kind of copay do you want for a doctor visit? Are you okay with a $30 copay or $50 or $60 copay? So we try and design everything to give them what they want. And then we talk about a subsidy, because you can get a subsidy in California up to about 500% of the federal poverty level in San Diego County. So we put all those together to get the best plan for the client.
You know, you throw out that number. Can you explain to me about how that works as far as the subsidy is concerned, how your income is measured, and what kind of subsidy you would... Walk me through that a little bit.
So if you make less than about $17,500, you're going to be on Medi-Cal. If you make more than about $45,000, you're not going to get a subsidy at all. And in between there, it really ends for a single person. In between there, you're going to get help from the government to help pay for your health insurance. So I was helping one of my clients whose son turned 26 right now, and we got him a plan for like $199 a month, and the government was going to contribute about $150 a month. So that was really like almost a $400 a month or $300 a month, $350 a month premium that they were only spending about $199 for, and they had pretty good coverage. So that's one of the big things to look at is, if you have a family of four, you can get a subsidy up to almost $100,000 to help pay for the health insurance. So we look at that and try and come up with a plan that's going to work for everybody. And it's really important this year because January 1st, we have penalties again. $695 at 2.5% of your income. So if you have somebody making $30,000 a year, the penalty is $750 or $62.50 a month if you don't get insurance by December 15th, and you get it by the end of January. You're going to get a February effective date, but you're going to pay a penalty for a month.
For the people who think they're going to duck out on that penalty and not be caught, they always find you, right?
They're going to find you because when you do your tax return, it's going to say, do you have health insurance? And if you don't, you're going to get docked 2.5% of your income. So if you're making more than 30 grand, you're going to pay more than the $695.
So your refund or whatever you think you're going to get back is going to be missing a health care deduction.
And the other big thing right now is because of the penalty, almost every group health insurance plan is allowing people to now come into the plan in January to avoid the penalty, because we're seeing a lot of emails about that. So if you decided I didn't sign my kids up or I didn't sign up, there is a special open enrollment for group plans. So just be aware of it, because they're going to get you. You know, the Franchise Tax Board is running this, and when you're supposed to get your tax refund, you find out that you get a letter from them saying you owe us money. It's not a pretty sign.
No. So put a bow on this. Okay. One sentence. What is you're sitting here because you want people to know the 15th.
The 15th is the last day to sign up to get a 1/1 effective date, January 1st. If you don't sign up by the 15th, the next effective date is February 1st, and you have until the end of January to sign up.
Right.
Good to see you, Paul.
As always, you know, pretty soon I'm going to be able to give a course in all this.
You will.
Give me 3 or 4 cracks at it. I'll even, hey, by the 15th, you all have some decisions to make.